Hope you guys had a great weekend. And if you are watching right now, let me know where you're watching from. Let me know where you're watching from. Make sure that you say hello. We always love to see people watching from all over the world. So make sure that you let me know. We are also live right now on Facebook. We're on YouTube. We're on Rumble. And we are also streaming live on Instagram right now. I know that I jumped off and had to jump back on. We had a problem with our stream. Technical difficulties. It always happens at some point. So, guys, if you're watching right now, again, make sure that you say hello. Let me know where you're watching from. And guys, today we're going to be going over health myths debunked. I know I sent out a post on social media. I said, hey, what are the biggest health myths that you have heard that haven't been true, that people may still do and they have no idea like why they still do it or why they believe it's true? And you guys let me know with probably like 100 messages, and they were all amazing, by the way. And I can't actually let me check my sound and make sure the sound is going right now. Testing. Yep, I'm good. All right. So I can't use all of them, but some of them I did use. So we're going to have probably about 15 or so. That's we're going to use about health myths, and we're going to debunk them, and we're going to let you know from kind of a different perspective as far as how or why they're actually just not true. So health myths debunked. While people are jumping on, and if you can as well, let me know if you can hear me, and we might be having some problems with the sound. So let me know. I think my mic is on. It looks like that it is connected. And sometimes I can do a mic check by actually just plugging it in and seeing if it's in fact working. So if you are on Facebook or if you are on YouTube, just let me know if you can hear the audio version of it. I think you can. All right, cool. So while we have people jumping on right now, let's go over just a couple of things, guys. Coming up August 29th at 6 o'clock p.m., we are going to be having our in-person inflammation event. If you are from the Chicagoland area, you want an opportunity to work with the Wellness Way Yorkville, work with me, work with Dr. Brian as well. We would be honored and humbled if you wanted to do that. I always tell people, get to the inflammation talk in person if you're from the Chicagoland area. It's going to be Tuesday, August 29th at 6 o'clock p.m. This is an in-person event. And I know people ask me at least, 10 or 15 times a week, hey, what do I need to do to work with you remotely? That schedule is a little bit smaller, only because I only work remotely with people at certain times of the week, because we are in full-time practice. But you can go ahead and register to join the webinar. Actually, in this post, you'll see the link tree in which you can join that webinar. So go ahead and join that webinar. You can schedule it out. I think we do it every Tuesday and Saturday morning, or if you want to watch it on demand, you can watch it on demand if you have about an hour of your time. You'll see at the end, you'll see a link to schedule a discovery call with me, and then just follow the link, and then you'll be able to schedule it at that time. So inflammation talk and webinar. These are the flagship events, guys. And once you understand, inflammation is just the first thing that we are working on to try to bring down and find some of the causes. I'm going to give you a really interesting example. And this happened today, but we have a gentleman that I've been working with for about the last 3 months. And he went on a vacation. And every morning on the vacation, he said, I did pretty good, but I had eggs. Well, this gentleman had a very severe IgG allergy to eggs. And he said, when I got done with my vacation, I had gained 18 pounds. And I kid you not, he's like, my joints were swollen. I could indent into my skin, and I had gained 18 pounds. I'm like, hey, listen, you didn't gain 18 pounds of fat. You gain 18 pounds of water retention, and inflammation, like swelling, causes a lot of water retention. I'm like, I bet if you avoided eggs and you gave it 3 to 4 days, that would go down. He's like, yep. And then I lost 18 pounds. You guys realize when it comes to weight loss is that the initial weight loss that people experience in our office has really more to do with the loss of inflammation. And because of that, water and swelling go with it, which is why, I mean, we have seen people have lost 20 to 25 pounds, especially when they have a lot of gastrointestinal issues going on. So inflammation is the first step, but if you don't handle inflammation, everything that you do afterwards is not going to work and it's not going to make sense. And then coming up, save the date again, October 24th, 2023, Dr. Patrick Flynn, best-selling author of I Disagree. He's going to be doing the tour around the United States. His stop in Yorkville is on Tuesday, October 24th. We have the venue booked. We are selling tickets. And people ask me, they're like, will I learn anything at this event? I'm like, yes, you will. I promise you. For the cost of like cheaper than going to a movie, you can come to this event and some food is included. We're going to have awesome giveaways, but this is going to be, guys, an awesome event. Everything is booked. We're in the process. Ticket sales are now live. Please get registered for it because we will set a date in which ticket prices will increase. And it's going to be an awesome event. So if you're from Iowa, if you're from Missouri, if you are from Illinois, from Indiana, Michigan, Wisconsin, please, if you can, come down to this event, Chicagoland area. I guarantee you guys, you will not regret hearing Dr. Patrick. And in fact, when people say, well, where did you learn everything? I said, Dr. Patrick got me started. He got me inspired. And he was the one that was really responsible for helping my wife get better. And he started that process. And he's the one who really inspired me to become the best that I could be and to be absolutely obsessed with clinical results and obsessed with constant and never-ending learning, which is what I do. In fact, it bothers me sometimes that I get so obsessed with learning. But the thing is that when people don't have answers, where are they going to turn? They don't have any place to turn. And so I'm always doing my best to try to connect the dots as much as possible for people. So please, guys, you can go to Linktree and you can buy tickets right now. Bring yourself, bring your spouse, because halfway through, usually the wife will always say, I wish I would have brought my spouse because there's information that's valuable to both of you. And if you guys actually understand hormones, it will help your relationship tremendously. So guys, let's get into health myths debunked. All right. I'm going to go pretty fast, but I'm going to give you a different perspective about this. How many of you guys have heard that, you remember this because, my father told me this when I was young, because I would, go and I would play a sport and then I would go out, without a coat and without a hat on. And he would say, hey, you'll catch pneumonia outside if you have a wet head. You need to cover your head. You guys understand that that's not, in fact, true, that you don't catch pneumonia. You may actually even be saying, oh, well, you catch pneumonia because you catch a bacteria. Actually, that's not really true either, because the bacteria that can cause pneumonia are considered normal flora within the lung lining. So, and if you've heard the immune system webinar that I've done, you can actually see it on Rumble because it got banned on YouTube. You'll actually notice that if you go into Guyton and Hall's medical textbook of physiology, they actually say that this bacteria is normal within the lungs. So we think that going outside with a wet head or breathing in bad air, that was from like the early 1900s, and it was called the miasma theory of disease. How many times you may have done this as well, and this isn't even part of the health myths debunked because I thought this would long be debunked, is they'll say if you are not feeling well, they'll say, why don't you go outside and get some fresh air? Or why don't you open the windows of the car and let some fresh air in? And that's not the reason why you're sick either. That goes along with the whole miasma theory of sickness and illness and disease. In fact, if you go back 300 years, they thought the reason why people got sick was because of bad blood and that you needed to bloodlet. That was the premier medicine of the day, was to, cut someone and then take out all of their blood or just enough in order to get rid of the bad blood. Then it was bad air. And then they were saying, well, it's all caused by bacteria and it's all caused by virus. And I'm like, well, if that's true too, then everybody exposed to bacteria would get sick, but some people do and some people don't. So this is actually still prevalent, like go outside and get some fresh air, but it just is something that has continued as a wives' tale, that the reason why you're sick is somehow because of bad air. So let's go over some myths when it comes to immunity, when it comes to nutrition, when it comes to fitness, when it comes to your hormones. Oh, by the way, you talk about hormones and everybody gets offended for some reason. And let's even talk about cardiovascular myths as well. And yes, I understand this is not, and this is not like a end all be all of a list, because there's probably another 100 things that we could talk about, but let's just go over some of them and spend some time together and enjoy, get a different perspective, and maybe even a laugh on the way. All right. You guys ever heard this? The science is settled. Or they'll say, I trust science. Well, if you trust science, that's actually goes against the whole thing about science, is because if you have to trust science, it means that there's something inherently not true about science. You shouldn't have to trust science. It should just be basically, a self-revealing type of thing. But here's what's so interesting when people say the science is settled. You guys realize there's so much that we don't know about the body. And I'll give you a perfect example. When I was in undergrad, I did like pre-med, and then my major was in exercise science, exercise physiology, sports medicine, things like that. And what's interesting is when we talk about muscle contraction, one of the things that kind of caught my ear is let's talk about the theory of muscle contraction. I'm like, wait a second. I mean, that's a theory. That's not like a universal law. And it's called the sliding filament theory of muscle contraction, meaning it's still a theory. It hasn't actually been proven yet. Yet we will say, well, that's the way that muscles contract, but it's not settled. And that's why it's still a theory. So there's so much when people talk with such authority and with such conviction that this is the science and this is exactly, the way that it is. Just realize is that, if you look at the research on things like Vioxx, on Bextra, if you see some of the research, and if you trusted your doctor about, certain types of pain medication, if you trusted your doctor, about some of the, morphine and heroin-based pain medication, and 400,000 people died from overdoses, that was all safe and effective, and the science was settled at that point. So you'll notice that, they're so confident saying the science is settled. And in 20 years, we realize now, I guess it wasn't settled. So that's true when it comes to muscle contraction. But ultimately, guys, when people say, well, hey, how do you figure this out? Well, it just comes from two different perspectives. The first perspective says, hey, the body is kind of stupid and it's just a bunch of parts and machines, and it's going to make mistakes, and whatnot. And I say, well, what if the body doesn't make mistakes? What if the body is a perfect piece of machinery that is designed to adapt, and that when people get sick, it's actually the body trying to adapt to help you live longer? Wouldn't you agree that the body is built for survival? All you have to look is have a bear chase you and see the physiological reaction that takes place when a bear chases you. Changes in blood pressure, changes in vision, respiration, changes in the digestive system, changes in stress hormones, how stress hormones go up, fertility hormones actually go down. And the body says, I want to adapt to survive. That's the number one thing. So we look at it from a perspective of saying, hey, maybe the body's not trying to be sick. Maybe it's trying to adapt. Maybe it says, I will adapt now with a consequence later on. That's why we always talk about, like, when I ask people, is high blood pressure bad? And everyone says it's bad. And I say, okay, we'll have a bear chase you, and then we won't allow your blood pressure to go up, and surely the bear will win. So blood pressure, things like that, is a survival mechanism. It's a survival mechanism. And yeah, great in the short term, but it's not good when it never, ever goes away. So think of this. You have to ask yourself the question. This is the perspective that I'm going to be coming from, is does the body make mistakes, or does it adapt in order to survive? And once you start looking at it from a different perspective, you'll say, okay, that starts to make a lot of sense. So let's talk about immunity myths. Okay. Here's the first one. You catch a cold. I caught a cold. You don't catch a cold. There's a great quote that says, if the germ theory were 100% true, no one would be alive to even believe it. So here's a question for you, is that why is it that two people can get exposed to the same virus and one gets the sniffles and the other ends up in the hospital? Is it not the same virus? Then what is the difference? The difference is the adaptability of the host. Let me give you another perfect example when it comes to viruses and things like that. You guys ever heard of Epstein-Barr virus? chronic fatigue syndrome, also associated with mononucleosis. And every time someone says, yeah, I had mono, and then I want you to think about it, said, well, when did you get mono? And you're like, oh, I wasn't sleeping. I was super stressed out and I wasn't eating right. And I was playing sports and I was getting, it's getting so, I was so stressed out. I'm like, well, there's your answer right then and there. Because why did it bother you then? And why did it come back maybe 10 or 15 or 20 years, down the road and present as symptoms of chronic fatigue syndromes or maybe Hashimoto's thyroiditis, things like that. So guys, it all has to do with the adaptability of the host. It's not some kind of virus that comes in and attacks you. We're under attack by viruses and bacteria all the time. Let me give you a perfect example. Let's say you run over a possum, you leave it in the road. And if you left it in the road, especially in Chicago, it's supposed to be in the hundreds, I believe, tomorrow and Wednesday and Thursday. By Thursday, you're going to notice decaying, putrid skin and a bloated belly that's getting ready to explode. That bacteria and that virus didn't crawl inside of them. And in fact, it was already there. And as soon as the immune system stopped, then that bacteria continued to do their job unchecked. So they didn't catch a bug. A maggot didn't, decide to jump in on them. It didn't kill them, but unchecked by the immune system, it's only doing its job. So do you catch a cold? Well, you catch a cold when your resistance is down. So the whole part of immune system is how do you keep that armor up as best as possible? How about number 2? Fevers are bad. Fevers are bad. We've been taught that fevers are bad and that fevers are supposed to be suppressed as much as possible. And fevers aren't bad. Fevers are part of an acute inflammatory process in order to be able to speed up metabolism and to create a set point of a temperature that is inhospitable for a virus or a bacteria. You'll notice that a fever set point of 103, 104 is really for a bacteria, and 101, 102 is usually for a virus. But we say we need to suppress that fever. And I'm like, well, that's actually what's causing the fever is the immune system. It's the immune system that are emitting inflammatory cytokines in order to mobilize other immune system cells and also to create a more inhospitable environment for a virus or for a bacteria. And then we say, well, what about, it's going to cause brain damage? The fever doesn't cause the brain damage. The infection does. Well, what about having a febrile seizure? I have had a baby have a febrile seizure right in my hands. And I said, the baby's going to be fine. And they're like, well, we're going to take the baby to the emergency room. And then the emergency room attendant looks at the baby and said, the baby's going to be fine. It's just a febrile seizure. It's just a resetting. And you probably see that the fever has completely gone away at that point. But we are conditioned to believe that fevers are bad. It's not the fever that's bad. It's the sickness that can go bad, and then refer to the whole idea of you are catching a cold, which is myth number 1. How about number 3? Boost your immune system. So many people talk about, well, I'm going to boost my immune system. The reality is that you can't boost the immune system. When someone says that this will boost the immune system 400%, I say, well, define that. Because does that mean that your body is going to then generate 400% more immune cells? It doesn't do that. You can't boost the immune system. But what you can do is you can restore sufficiency to the immune system, and sufficiency is enough. So when someone says, hey, if you take vitamin D, you're going to boost your immune system by 400%. And I'm like, are you going to just boost it into autoimmunity? I mean, is that the type of immune system response that you're shooting for? But you can't boost your immune system. But yes, you can feed the immune system, and you can create something in your body that is preferable towards having a normal and sustainable and an immune system that will suffice and bring it up to restoration. That's what we do a lot when we do immune system testing with people. It's like, here's where you're at, and here's where a normal immune system should be functioning at. Here's the 4th one that is going to ruffle so many feathers, and I'm sorry, and I'm not sorry at the same time, all right? It's the idea that when people say, yeah, but vaccines have saved millions of lives. I say, well, how do you measure millions of lives? The only reason why you can never ever measure that is because there's too many confounding variables. Actually, if you go and you look at the death rate from things like measles, you will see that the death rate from measles was in massive decline even before vaccination was ever introduced. And it also goes to the fact that if you look at measles, measles is a benign self-limiting disease. Yeah, but some kids had problems with it. Yeah, maybe 1 in 1,000 mortality rate, but then go back to, well, what was the response of the immune system, and were there problems with the immune system? But when you say they've saved millions of lives, well, the reason why that can never be proven is that's like saying because you see an association, that means that that caused it. Well, at the same time, one of the things that we also saw is we saw improvements in sanitation. We saw other improvements, which is why it really can't ever be proven. And I love when people bring up, hey, can certain whats can it cause neurological illness, developmental delays, inflammatory issues, gastrointestinal issues, asthma, allergies? And people are quick to say correlation doesn't equal causation. But then I say, yeah, but you just made the correlation equaling causation by saying that vaccines have saved millions of lives. This is coming from an individual who was damaged at pre-kindergarten and developed severe asthma and allergies from about 4.5 years of age until about 23 years of age. So no one makes that correlation between the two. But when they say it saved millions of lives, remember this is that the presence of antibodies do not confer immunity. If you understand the immune system, antibodies do not confer immune system. You literally can stick a piece of wood underneath your skin and say, look it, I now have wood antibodies to it. Anything that you bypass the barriers, you stick it under the skin, will elicit an immune system response. But how our immune systems are supposed to work is actually from exposure at the barriers in order to generate a true and long-lasting immune system response, and one that will involve memory T cells. And it has to happen at the barrier. But it doesn't happen when you start to bypass the barriers and inject certain things directly into the body. But it will cause a hyperactive immune system response because it stimulates different parts of the immune systems, especially eosinophils, which is also why you're going to see an increase in things like food allergies, like you've seen over the last 30, 35 years, which is also why you're seeing a lot of autoimmunity start to develop over the last 40 to 50 years, neurodegenerative illnesses, things going on, things like ADHD and things like that. Now, you may say, well, that doesn't mean that it's caused it. But if you want to use the same line of thinking, then I'll use the same line of thinking as well. So let's talk about nutrition myths. So nutrition myths, all right? How about this one? Milk does a body good. Milk does a body good. Now, what I'm going to specifically talk about is I'm going to talk about calcium. Like you need milk in order for you to get enough calcium. Do you guys want to understand is that this was the milk does a body good was a marketing effort. When you talk about calcium and things like that, because when people say, what do you mean? Like milk's not that good for me? You guys understand when we do food allergy testing, the number of people who do in fact have an allergy to casein or to the other protein known as whey, it is unbelievable how many people have an inflammatory response to those things when we are doing IgG and sometimes IgE food allergy testing. So they say, yeah, milk's not going to be good for you. They're like, well, where on earth am I supposed to get my calcium from? And I'm like, broccoli. Like literally anything that grows from the ground will have calcium in it. But the other thing that people are worried about is they're worried about osteoporosis. And do you understand that is that calcium is a small factor when it comes to development of osteoporosis? There's other factors involved, like the absorption of calcium. You can have calcium until the cows come home, but if you're not absorbing it, that's going to be an issue. The other thing is if you're not doing any kind of exercise that's actually going to signal the bone to become stronger and to remodel the bones, then having calcium is not going to be any benefit for you. And another thing too is that if you are severely deficient in hormones, and there's reasons why a woman specifically will be deficient in hormones, then that also will play a role in your bone health as well. But everybody to say, I'm going to douse myself with dairy and I'm going to take a calcium supplement, it just simply isn't true, because I believe the last time I checked, we're second in the world in the amount of dairy we consume. And I think we're like first in the world in the incidence of osteoporosis. There's a lot more things, a lot more factors at play. How about a natural health perspective? This was popular probably about 15 years ago, and you need to alkalize the body, meaning the body gets sick when it's acidic. So you need to alkalize the body with a lot of alkalizing foods, alkalizing water, and things like that. Here's why this doesn't make sense, because any food that you eat and any water that you drink is going to enter into the stomach that has a pH of about 2 to maybe 3. When they're talking about alkalization, they're talking about anything above 7. So if you are deciding I'm going to eat alkaline foods, they are then entering into the stomach that has a pH of 2. So alkalizing the body, it just simply doesn't work. And even consuming high alkaline water really, in my opinion, is only putting stress on the stomach, because it's going to require more stomach acid in order for that to be able to push that up when you're putting high alkaline type foods. Okay. Now here's number 3. You need to drink more water. 8 to 12 glasses, everything, like push water and water and water. Here's what's so interesting. Let's talk about thirst and let's talk about hunger. Okay. Because people will ask me, well, which one can become a liar? Now, hunger can absolutely become a liar. And the reason why is if you understand a hormone that's known as leptin, when we check people's leptin levels and they're at 40, 45, 50, 60, I look at that person, I say, you're leptin resistant. And I imagine that you're hungry all the time, even if you don't need any food. And they're like, yep. So this is also true when you look at people with obesity. And I know a lot of people, they don't have compassion for them because they may not understand the hormones that are at play. But when someone says, I just don't understand why this person can't stop eating, well, when they become so leptin resistant, they effectively don't have the mechanisms of the hormones receiving in the brain and then to be able to hear that hormone response to actually say, I need to stop eating. And so they just tend to overeat and overgraze all the time without any of those signals. Now, when it comes to water, we don't have that signal of being like water resistant. Like we're actually thirsty when we're not. That we don't lose that sensation from. And so when someone says you got to, I mean, people they've come in before pounding gallons of water. And I'm like, are you thirsty? They're like, no, but I'm just told that I'm supposed to drink a bunch of water. So which is going to be more accurate, thirst or hunger? And I will say all of the time, it's going to be thirst. But the other thing is too, is if you are going to drink any water, then drink water with some kind of purpose. Water is the vehicle in order to deliver nutrients. What I'm drinking right now has a little bit of potassium in it, has a little bit of magnesium in it, and a little bit of sodium in it. So you need electrolytes. You do need the electrolytes, but you should be also getting your electrolytes from salt. You should be getting it from potassium and magnesium that you are getting from your food as well. So this whole idea that you need to drink 120 ounces of water every single day, guys, do you understand that when you burn fat as an energy source, you get energy and you also get water? It's one of the reasons why people can dry fast for 3 days, not drink any water, because when they burn fat, they're releasing water into the body. I don't necessarily recommend that though. How about the fourth thing? Saturated fat is bad for you. How many have heard that? And how many have also heard of literally science going back and forth, meaning that saturated fat is bad. No, I guess it's okay for you. Eat butter. No, butter's going to kill you. Eat bacon. No, that's also going to kill you as well. Red meat is going to kill you. And in fact, what we have seen is we've seen that the whole idea of butter and bacon, that's how we got into the whole margarine and trans fat mess to begin with. That is that we demonized it. Then we said, do it. And now we're actually seeing this demonized again. So is saturated fat bad for you? So is butter bad for you? Is red meat that contains saturated fat, is it bad for you? Is coconut bad for you? I don't believe that is bad for you. And again, go back to what are things in nature that are closest to its original form? Are they necessarily going to be bad for you? However, I will tell you what is really, really bad for you. And that's going to be partially hydrogenated oils that are going to be things like cottonseed oil, or certain other seed oils that are hydrogenated, which makes them more stable at room temperature so they don't melt. That in the of themselves will cause problems with the liver and will also contribute to fatty liver. And what's interesting is that that will contribute to fatty liver. And once you develop fatty liver, then watch your cholesterol levels go up and things like that, because anything that involves the liver will be involved with energy metabolism, the removal of cholesterol from the body and excreted through the bile. So is saturated fat bad for you? No. But I guess eating a ton of just one thing could potentially be bad for you. But what you should actually be interested instead is going to be hydrogenated or partially hydrogenated oils that are stable at room temperature. And without hydrogenation, then what happens is that they are liquid at room temperature. So those are some of the nutrition myths. Okay. How about some fitness myths? You guys ready for some fitness myths? If you're ready for some fitness myths, please give me a thumbs up and say, I'm ready for them. Because I've talked about these, and doctors have been like, no, you're wrong. You need this. But I'm saying, let me show you from a different perspective. So here's a fitness myth. This comes from like the World Health Organization, and they say you need 150 to 300 minutes of exercise per week. So 150 to 300 minutes could come out to, 60 minutes of exercise 5 days a week. Now, how they categorize this type of exercise is basically known as moderate intensity that's not elevating the heart rate, maybe at about 60 to 65%. And so I say, well, then you don't need 150 to 300 minutes of exercise per week. And let me explain to you why. The reason is this, is that if I perform the same amount of work that you performed in that 300 minutes, and it only took me 30 minutes, then technically, if I'm performing the same amount of work, then why would I wait to try to tease it out for 300 minutes done at a moderate intensity? And so this is why they do say that if you are doing it at a higher intensity, then you're going to need less. See, if you try to get 150 minutes of high intensity, unsustainable type of exercise, 150 minutes per week, your body will fall apart. So when it comes to exercise, the effectiveness is in the dose. You need some, but you can also get too much. So do you need 150 to 300 minutes of exercise per week? When I talk about actual physical conditioning, we're not talking about weightlifting. We're not talking about, hey, I got to warm up. Hey, I'm going to do some heavy lifts. If we're talking about cardiovascular exercise, AKA conditioning, I actually will keep it to about 60 minutes per week. But in that 60 minutes, I will do more work than many people in 300 minutes. See, the thing is 300 minutes is just movement. But in that 60 minutes, what's happening is I'm getting better cardiovascular conditioning. I'm expanding my lungs more. I am doing it at an intensity that's going to help my muscles and liver become more insulin sensitive. And at the same time, I'm even lifting heavy things in order to help build muscle mass. So do you need 150, 300 minutes a week? Yeah, if you decide that you're going to do it at a very moderate intensity with not as much cardiovascular benefit as if you would be doing it at a high intensity. How about number two? I don't want to get too bulky. Now, back in the days when my wife and I, when we owned CrossFit gyms, that was the number one complaint that was coming from women. And I said, hey, I don't want to get too bulky here. I tend to put on a lot of muscle mass, and so I don't want to end up looking like a man. Well, here's something that you can take to the bank. You won't. If you are a woman, you will never, ever look like a man. And if a woman has the physique of a man, then they're taking exogenous hormones in the form of testosterone or some derivative of it. So when someone says, I don't want to get too bulky, I want you to understand that normally a woman's testosterone levels are about a 10th to a 15th the level of a man. And that can be highly debatable depending on if they're menopausal or if they're cycling, because testosterone does in fact spike when you ovulate, and it can spike at a little bit higher levels. But even if you said a woman's on average hormones are about, testosterone is about a 10th of a man, then you don't have the muscle building response that a man does. And you don't have to worry about looking too bulky or looking too masculine. How about number 3? Running is the best way to get into shape. And in fact, how many times when people say, I'm going to get in shape, I'm going to start running. And I'm like, great. What about rowing? What about biking? What about lifting weights? And what about squatting? What about jump roping? What about all of these other modalities that you can use to become a better, well-rounded athlete? And in fact, if the only thing that you do is running in order to get into shape, your body will adapt to running. And what that means is that your body will adapt to not sprinting, but running at a very small stride length. And this is why you will see changes in your hips. You'll see changes in your spine. You will see changes in even the angles of your spine from the side. And this is also why, if that's the only thing that you do, I'm glad that you're doing something, but it's also a great way to become extremely adaptive to running. And in fact, the more that you run, the more adaptive you become. Your body adapts to running, which means you're actually getting you're not getting as much bang for your buck if that's solely the only thing that you do. And that's why when it comes to fitness, running is only one modality, but then you have things like rowing, you have things like biking, like an echo bike, you have things like jump rope. Heck, you could even start doing zigzag sprints, box jumps. You could be doing squatting. You could be doing wall balls. You could be doing push-ups, pull-ups, handstand push-ups. You could be doing back squats, front squats, cleans, press, snatches. And it literally is infinite, but you want to be as well-rounded as possible, because there is nothing in your life that you need to jog for. If a bear is chasing you, then you should sprint. But you do need to pick things up off the floor. You do need to get off a toilet. You do need to get off of a couch, which is squatting. You do need to be able to press. You need to pull yourself up from a certain position. And so if you're going to dedicate the time to becoming more fit, then become better, more roundedly fit, versus just sticking to one modality and then suffering the consequences of the body just adapting to that. Now, how about this one? I have arthritis because I overdid it. Okay. I have arthritis because I overdid it. Now, let me give you an example. Okay. Let's say that I break my wrist. And the doctor decides, orthopedic doctor says, we're going to put a cast on it, which is exactly the right thing. Realign the joint, put a cast on it so it doesn't move, so those bones can actually fuse together. So while you have a cast on your forearm and you're not allowed to move it at all for 6 weeks or for 8 weeks, what do you think happens to that joint and to the muscles around it? They atrophy, they lose flexibility, they will actually start to stiffen up. And then you get the cast off at 6 weeks or at 8 weeks, and then you decide, hey, I'm going to try to move my arm. But when you try moving it after being immobile for 6 to 8 weeks, you notice that my wrist is stiff, it's achy, and it's weak. If I have a stiff, weak, and achy joint, and I go into the doctor and I say, Doc, my wrist is stiff, achy, and weak, doctor's going to say, well, you probably have arthritis. But if you get the cast off, the doctor's going to say, you need to move it and rehab it in order to get the strength and the flexibility back. But if you go to the doctor and say, oh, my knee, it hurts, it's stiff, it's achy, it's missing out on range of motion, the doctors say, well, you probably overused it and you have arthritis. And then you're given the recipe to try to avoid doing certain things for the rest of your life. And what happens as soon as we start trying to avoid things for the rest of your life? We just continue to get worse. So why do you get arthritis? Is it because that you overdid it? Or maybe you didn't use it enough, or maybe you have some issues when it comes to blood sugar that will absolutely damage and destroy your joints and including your cardiovascular system, because that's what high blood sugars do. They cause advanced glycation end stages, and it glycates what's known as your soft tissues. Okay. So, and it also could be doing things with absolutely terrible form. Because, yes, if you do things with terrible form, that puts you at a biomechanical disadvantage. Then one of the things that's going to happen is that you will inflame the joint over and over and over. And then the body, what it does is it tries to adapt by that, by laying down bone in certain areas if you don't listen to it. But the whole idea of saying, I got arthritis because I squatted too much, or I got arthritis because I did too much weightlifting, the only time that you're going to get it is if you're doing it incorrectly. And in fact, the joints need it desperately, because if you don't, then the body begins stiffing up. If you want more flexibility, then you have to move. Now, how about some hormone myths, guys? Here's the first one. I can't lose weight because of my metabolism. So it's my metabolism that is off. When people say that, I say, okay, well, what do you mean by metabolism? Well, my ability to utilize energy. And I'm like, okay, well, what determines how your ability to be able to utilize energy? And the reality is that it's pathways and that it's enzymes. So when people say I have a bad metabolism, what they're really saying is I have a deficiency of certain enzymes. Now, sometimes it can be due to your thyroid, because if you do have an undiagnosed thyroid condition, it can actually cause a decrease in function of the liver, which is why one of the things, guys, that you will see when someone has an undiagnosed thyroid condition, you'll see very high triglycerides, especially. But when you talk about metabolism, this is why when we detox them, and I hate that word because it's misused so much. Basically, all we do is we feed the liver what it needs in order to metabolize, feed those pathways. And this is why a lot of people who are having issues with weight loss resistance and things like that, when you feed those pathways, metabolism starts to improve. And so this is why when people say it's my metabolism, it's like, no, it is your enzyme activity and certain pathways, even when it comes to hormone function as well. How about this one? Menopause is a disease. Menopause is a disease. I know I put a video out and we talked about a woman who was on hormone replacement therapy and said, she said, I feel awful being on this. And I said, well, when we tested this, yeah, here's what's happening. Here's how it's getting metabolized. And lo and behold, everyone like that had been on hormone replacement therapy started to think that I was attacking them. Now, menopause, I don't have personal experience from it, but just because I can't experience it doesn't mean that I don't understand the mechanism of why it happens. And I want you to think about it. If it was a disease, then it would be a disease for everyone. So some women sail through menopause, and some people, women have a really bad day when it comes to menopause. And so the question is why? So are you going in? Because guys, if you have hormone issues when you are cycling, then don't think that it's just going to go away when you hit menopause, because your body is leaving you clues. Hormone problems before menopause, you will have some of the most severe menopause symptoms when you hit it, and it's not necessarily going to go away. If you are doing things that are creating inflammation that can be hidden during your active cycling, because again, estradiol can be extremely anti-inflammatory, as can progesterone. If you are doing that, then you have a drop in hormones. It's going to be a really, really bad day. So when you look at menopause, we say it's not a disease, but your body is leaving you clues. How's your liver? How's your liver metabolism? How are your adrenals? Do you have any infection that's going on? Well, what's your body fat percentage? There's so many different variables, but a lot of things of what we do is we want to just do the easy approach, but just saying, give me hormones. Just put hormones in me and make me feel better. Will they make you feel better? Yes, absolutely. But it's still not addressing the cause. So we have to stop thinking, calling it a disease, because it's a transition, and it is a normal transition in women. How about chronic fatigue? A lot of times when women come in, men can come in too, but a majority of thyroid issues are with women, but they say, I'm feeling fatigue and it must be my thyroid. And I'm like, okay, well, we can test the thyroid, but there's other things at play here. And so you actually test the thyroid and like, your thyroid is normal. And they're disappointed because they're saying, well, then what's causing my fatigue? And I want you to think about this is think of fatigue and the immune system. So when the immune system is fighting things, whether it's a virus or whether it's a bacteria, and think about when you got the flu. When you got the flu and the immune system is hard at work and it's doing its job, your hormone profile of cortisol and cortisone will change. Cortisol is basically your energy hormone, and it mobilizes blood sugar. Cortisone is the anti-inflammatory immune system component. So if you're extremely high in cortisone, you'll be low in cortisol and you'll be very fatigued, and you're probably dealing with something inflammatory or some kind of infection. And so it's not adrenal fatigue. Many times it's not your thyroid, and it has to do with your immune system. When you can correct what's going on into the immune system and start addressing that, the number one thing that people will say is my energy is coming back. This is why the people say, well, I have adrenal fatigue. No, you don't. You have adrenal down regulation. Your adrenal glands are fine. They don't get fatigued, just like your pancreas doesn't get fatigued when you're 35 years of age. It's a process. And so the adrenals are down regulating as far as an immune system response. So if you have fatigue, yes, you can look into the thyroid, but always think of the immune system first. And how about this one? I have low testosterone because I'm just old, because it's my age. We hear this all the time. Low testosterone in men, we're seeing it get lower and lower and lower, earlier and earlier and earlier. But it's absolutely common for a man's testosterone to decline as they age, but that doesn't necessarily mean that it's normal. And so the same with women hormones can also be said with men's hormones as well, is that the sicker you get, the more you will have problems with your hormones. And I want you to think about it. If we go back and saying, hey, the body doesn't make a mistake, that if I'm sick, is that a great time to reproduce? Because when you look at your progesterone, your estradiol, you look at your testosterone, these are primarily, first and foremost, reproductive hormones. Secondarily, the secondary characteristics might be muscle mass, and things like that. But when a man says I have low testosterone because I'm 40 years of age or I'm 50 years of age, I say your testosterone levels after puberty should be going up and should stay consistent until the day that you die, unless you beat yourself up. So that's why when men say, oh, I'm on TRT, I say, hey, great. All right, well, what's your insulin levels? What's your C-reactive protein levels? How much alcohol do you drink? What's your body fat percentage? How much sleep are you getting? And we ask those questions because those are all lifestyle things. Hey, do you eat any organ meat? Are you getting enough zinc? What is your nutrition look like? How many processed grains are you doing? How much sugar are you consuming? Because all of those drive down a man's testosterone. And so that's why I never like to cover it up with a hormone, because I have had men who have come in and who are on hormone replacement therapy, testosterone replacement therapy, and they felt great for a while, but then they start to develop some issues with the liver. They start developing gynecomastia or breast buds. And then the doctor says, well, okay, well, we're going to put you on aromatase inhibitor, and then you won't have that problem. And then you become another drug experiment. And I've seen some very bad labs with people who are on testosterone replacement therapy, and they felt awful and didn't know why. And because of the levels of testosterone that were prescribed. And so this is why when people say, would you ever take testosterone replacement therapy? I said, no, what I'm going to do instead is I'm going to take care of my health to keep it at a high level on my own. But people don't want that accountability. That's the problem. They don't want to say it's up to me, because we would rather blame something else and not take any kind of responsibility. And this is true when it comes to men and women as well. Now, the only problem is that we've been so misled when it comes to health and when it even comes to our hormones that I'm not blaming those people, but I'm saying, hey, look at it from a different perspective and now take this and take responsibility for it. And now you can actually do have a brand new lease on your life in which you are healthier and also have a better hormone profile as a result. Lastly, guys, let's go over cardiovascular myths. All right. Go over cardiovascular myths. Have you ever heard this? My artery was 98% blocked. Boy, thank God that we caught that because there was only 2% that was getting through that artery. And how many times have you said that? And you're like, really? 98% blocked? You should be dead if it was 98% blocked. And this is what's interesting about an artery being blocked. We think that the artery fills up with fat, and the artery doesn't fill up with fat. It actually forms plaquing underneath the interior lining of the artery, known as the intima, and the fat actually and the plaquing come out, but it's almost not like fat buildup. It's like a pimple that gets bigger. So is the artery 98% blocked? Well, it may look that way. I'm going to show you a picture here in just a second. But the amazing thing about the body is when you start getting plaquing and you start getting decreased vascularization, the arteries immediately undergo what is known as collateralization, meaning they'll start to form capillaries around the blockage. Otherwise, if that didn't happen, then the heart would cease to exist. So you form a capillary bypass as long as that's happening slowly over time. I'm going to show you a picture of that in just a second. How about this one? Eating cholesterol causes high cholesterol. It doesn't. Now, consuming hydrogenated oils will do that because of what it does to the liver, but eating cholesterol does not contribute to your cholesterol levels, very little of it. And the reason why is because the liver makes cholesterol based on demand. I want you to think about it. LDL is needed by every cell and every tissue of the body. And I also want you to think of this, is that 80% of your hormone production in your adrenal glands, and this is according to Guyton Hall's medical textbook of physiology, 80% comes from LDL delivered in the blood, 80% of your adrenal hormones. And so, so the whole idea of demonizing cholesterol has gotten so out of hand, guys, because I even want you to think of this. Even if you do go on a statin drug, the success rate, in fact, is as far as preventing heart attack or major cardiac events, depending on if you're talking about death or if you're talking about major cardiac events in people who have never, ever had a cardiovascular incident, over 5 years is about a 2% reduction, meaning it's anywhere from about 1 in 40 to 1 in 50, depending on, and if you look at other different criteria, 1 in 100, 1 in 50. What that means is that the success rate, the absolute risk reduction comes to 2%. Now, if you came to me and said, Dr. Nate, I want you to help me with my health, please help me with my hormones. I say, great. You know, I'm going to do some things with you. The chance that you're going to get better is about 2%. Then you would say, I think what I'll do is I'll find a different doctor. And yet we're super happy when it comes to, statins, because we think it will reduce our risk by 100%. But the benefits of it are actually overstated. And in fact, about 10% of people experience severe muscle pain and severe muscle breakdown. You'll see a little bit less people have problems with liver enzymes and things like that. And then they even now come out with, well, there's now a new drug out there called bempedoic acid, in which you can, that for people who are statin intolerant. And I just did a video on this in which they omitted this parts of the study in which some of the testing group actually had a higher mortality rate that took the drug than those who didn't. And they said, well, we're just going to omit that study and we're not going to report on it yet. But they only took the most favorable group. And then they took that and then everyone ran with it, including cardiologists. They ran with it without even looking at the whole study and saying that this is the next miracle drug as well. And so it kind of goes along with the heart disease is due to high cholesterol. Like there's some kind of linear with the higher cholesterol, the more heart attack that I'm going to have. And guys, your body is way more complex and dynamic than that. And one of the reasons why so many people don't get better is because they don't look at the body as a Swiss watch principle. Meaning, if I take a drug, then it's going to cause other changes and adaptations in different parts of the body without saying, hey, maybe we should be looking at your fasting insulin levels. Maybe we should be looking at certain inflammatory levels or infection levels. That's why when they say, if I have gum disease, I have a higher amount of heart disease. If I have inflamed gums, think about it, I have a higher incidence of heart disease. And in fact, when you look at this here, if you see this picture right in through here, this is the right coronary artery. And this is doing when they inject a dye into the arteries. And where you see is you see that this blockage is right here. So I want you to think of it. When they inject the dye, then if it was 98% blocked, then you should not have any blood flow that's going down into the rest of the artery. So when you look at that, you're like, well, how on earth is blood getting around there? And that's because there's collateralization actually taking place. You guys know that where you're going to have most of your problems with your heart disease is not with old plaques, it's with the development of new unstable plaques. The body hasn't had a chance to be able to adapt to and be able to calcify that area. That's one of the things that calcification does, is stabilizes those areas. And here's another study. This comes from, this was in Cardiology Today. I pulled this off of Helio News. I've done a video on it before. Inflammatory risk better predicts events versus cholesterol risk in statin-treated patients. So one of the things they found is in all these groups of people that were on statins, the one who had the worst outcomes were the one who were actually most inflamed. And so when they're that inflamed, they're like, they had a higher incidence of heart attacks. When we say there's just this linear type of thing, that means that high cholesterol is heart attack, and it's more like this. And that's why we have to start looking at a lot of different things, just instead of just looking at cholesterol. That's it. But one of the things that they'll argue with in medicine is they'll say, well, it's the totality of evidence, which means that they're not taking you as an individual person. They're treating you like an algorithm. They're treating you like just as a formula. And so this is why the Wellness Way approach, it's so individualized per person based off testing, because if your doctor is basing your health on totality of evidence, then you don't have healthcare. What you have at that point is you have what's known as algorithm care. Algorithm care means if you have this, we give you this. If you have this, you have this, because of the totality of evidence. And meanwhile, there could be other 15 different factors that are playing a role in your health. And it's one of the biggest reasons why people don't get better, because it's not health care. It's called algorithm care based on totality of evidence versus looking at a person in the face and say, let's test you properly. Let's make this individualized that will help for you. And that's one of the reasons why when we have helped people get off of 6, 7 different medications, because we looked at testing, we determined the right ones, we gave an individualized approach and started correcting what was going on with physical stressors, mental stressors, chemical stressors, which is the whole premise of chiropractic actually, is saying we have the ability to get well. Our body will adapt when there's too many physical stressors, mental stressors, and when there's too many chemical stressors that are going on. And so either you're going to look at it as the body is stupid and it makes mistakes, or you're going to look at the body as brilliant and built for survival, and it will survive as long as possible until it reaches the point that it cannot continue to adapt any longer. And that's when we die. So all of these health myths, hopefully we've done a little bit of help as far as debunking those things. And just remember this, guys, the inflammation talk. If you're from the Chicagoland area, make sure that you go Tuesday, August 29th, right here at the Wellness Way, Yorkville, 6 o'clock. Please get registered for that, especially if you say, hey, I want to work with you, Dr. Thompson. Let's start figuring out health, and let's do health differently. And then obviously, if you are from the contiguous United States, or 48 contiguous states, go to the webinar that we have online. You can watch it on Tuesday. I think you can watch it on Saturday. Just go to the Linktree profile. You'll be able to see that. Or you can watch it on demand. If you have an hour of your time, you'll see a link towards the end to be able to schedule a discovery call with me. And that way we can start the process saying, hey, what do we need to do? And are also we a good fit? Is this something that I feel that I can help you with that as well? And then remember, you'll see in the Linktree profile too, you will also see the save the date. You can register and get tickets for the I Disagree tour with Dr. Patrick Flynn. October 24th, 2023. Starts at 6 o'clock. It's on a Tuesday evening. I know it's not ideal, but Dr. Patrick's an extremely busy person, and that's when he's going to be in the area. So we're going to run with it, and we're going to do awesome, and it's going to be a tremendous event. Please make sure, guys, that you get your tickets, and please make sure, guys, that if you need to get to the inflammation talk or get to the inflammation webinar, look forward to seeing you guys there. So, guys, health myths debunked. If you have any more, let me know. Maybe we'll do a part 2 as well. So, guys, thank you so much for joining me. Be well, be blessed, and as always, remember who you are. Thank you guys so much.